Today I'm going to be talking about a brief overview of prevention and treatment of diabetes and cardiovascular disease. So I suppose the first initial question is, who am I? I'm a portfolio GP based down in West Cork, and I'm also a marine biologist. So this time next month I'm going to be chasing grey seals around the islands of Mayo, trying to catch them and stick satellite tags to their heads. How much fun they will have, I'm not sure, but it's definitely quite fun for us, so we'll see how that goes. And I've been sort of interested in plant-based nutrition for a number of years now. Again, like Dr. Allman, been plugging away down in West Kerry. I was working away down there, again, feeling isolated, feeling alone, feeling, like I didn't know anyone else. So it's really wonderful to sort of have this gathering and see the movement growing. So the slides are all going to be on the website afterwards. I'm going to run through quickly the weight of evidence. So there'll be lots of papers, lots of slides, but you don't need to sort of photograph it all or take it down. I'd encourage you, as Sean says, to go away and actually read them, to look at them, to decide for yourselves. So I don't want you to take any of what I say on face value, although that would be nice. I think it's important that you go away and you own the information yourself, because if you own it, then you can transmit it in a much more confident and sort of a much more authentic way. So it's just nice to know our audience. I know there are a lot of healthcare professionals. Would you be able to just put your hands up if you're a healthcare professional of some description? Excellent, very good. Excellent, that's a good turnout. That's very impressive. So, again, a lot of the stuff we say will perhaps be echoed over. So to reference Sean slightly, as healthcare professionals, we often want to help our patients, we want to help our community, we want to be part of the role. And what we want to do is be able to make our patients feel better. And we don't want to make them feel a little bit better, which is what most of the drug therapies do. We want to be able to give them the opportunity to take control, to take back their health, to not look to us to make them better, but to just point them in the right direction and make them feel, or give them the opportunity to feel a whole lot better. And that's something that I hope at the end of today you'll be able to see that a plant-based diet can offer. This is something which can change the way we practice. It can reinvigorate us. We can go from feeling slightly disheartened at yet another diabetes condition, another high blood pressure, where we're giving them yet more medication, to the opportunity to really make them feel like things are changing and got something they can do. So, another question. How many of you, if you just raise your hand, feel like by the age of 74, you will have done everything that you want to do on this earth, and you'll be ready to happily shuffle off this mortal coil? Just look around, how many hands are up? So this is the age of 74. And the sort of World Health Organization definition of premature death is under 70, so we've pushed the limit up slightly. So remember that. And then the next thing I'd like you to do, so those of you who are willing and able, just to stand up. And I'm assuming that this is a predominantly sort of Irish-based audience. Most of us will be familiar with attending Mass, and that section in Mass where you turn to your neighbour and you shake their hand and you say, "Peace be with you." This time, I'd like you to do that, but I'd like you to feel the life in the hand. I'd like you to look them in the eye. I'd like you to see and be seen. You just spend a moment just doing that. Thank you very much. Please sit down. So, again, we've already heard about the numbers, about the number of people. So it's 7 million people a year die before the age of 70 globally from cardiovascular disease and diabetes alone. These are Irish figures. This is the first quarter of 2018, dying between the ages of 15 and 74. So not one of us would like to be that person. And it's hard to get figures into your head, but how many people did you connect with just now? How many people did you look at, did you feel, did you touch? 1, 2, 3, 4? So I suppose what I'm trying to say is those are real people. Those are people that have died. 1.3 people an hour. That's about 13 people have died already today. That's the people you've just touched, you've just looked at, you've just felt. These are the same people that are dying from cardiovascular disease. And it's just trying to get you to spend a moment to step out of your role as a doctor, as a healthcare practitioner, to be a human, to be present, to be there, and realise the trauma that this causes. So these aren't just numbers, these are lives. And these are lives that affect lives and they affect lives. So this is, to go back to Sean, this is something that we have the potential to improve, to change, and hopefully at the end of the day you'll agree that this is something that in some cases these are unnecessary suffering. The other thing, just about that episode, is just to reflect on the conformity. So I said, would anyone be willing to stand up? A couple of early adopters stood up, and then pretty much we got a full house. We did what the majority were doing, which is interesting. We were part of the team, we were part of the group, part of the kind of concept of standing up. And that reflects on how healthcare is practiced and what we do and how we eat and all of these things. So it's just something that, a simple thing just to remember. And the other thing is culture. So if I had said that in the UK, people would have looked at me and gone, what are you talking about? They wouldn't have understood. They wouldn't have known. I wouldn't have been able to explain what to do. That happened at my wedding. The UK side, all like looking around going, what the hell are we supposed to do? And then the Irish side, who were comfortable and confident and getting on with it. So again, cultural context is just really important. And it's just, again, something to bear in mind. So back to the sort of the main talk. So diabetes and heart disease. I mean, this is just a simple slide to say they're linked. I mean, I think pretty much we accept that diabetes is a risk factor for cardiovascular disease, and cardiovascular disease is a risk factor for diabetes. This is an interesting slide looking at our sort of biases and what we're willing to accept as evidence, and how powerful we think diet potentially is. So this is just looking at some of the prospective studies that are large, and because we hear some criticism against them. And if you can see at the top there, passive smoking, because if you're exposed to it or not exposed, you're more likely to get coronary heart disease or lung cancer. I mean, I think we'll all pretty much agree with that. Then on this side, 5 portions of fruit and veg a day, you've got a similar protective effect from all-cause mortality. Not intake. Again, 1 serving a day, you get a similar protective effect from cardiovascular mortality. So just simple, I mean, most of us will be familiar with the definition of diabetes, but this is just the World Health Organization. So it's essentially the body's ineffective use of insulin, and it's the main one. This is the one we're worried about. This is the one that's really affecting the global population. And then going back to why talk about it in nutrition. I mean, surely we've got loads of drugs. We don't need to talk about diet. So this is from the Lancet. Type 2 diabetes is largely rooted in reversible social and lifestyle factors. And they felt it necessary, which is also bizarre, to say a medical approach alone is unlikely to be the solution. So in 2010, they felt they should tell us that we can't just rely on drugs. And then again, they went on to say it's largely preventable and it's a public health humiliation. And they're strong words from a high-impact journal. This is an article in 2010. We're 9 years later, and I'm not sure we've made a huge amount of progress. So diabetes, insulin resistance, again, insulin, it's the hormone in the pancreas. The more you look into it, the more complicated it seems to become. But essentially, it seems to unlock the receptors to let sugar, glucose from the bloodstream into the cells to be used for energy. And insulin resistance, which is essentially the root cause of type 2 diabetes, is the cells that fail to respond appropriately to insulin. This simple slide, I think the important bit, so it starts many protein activation cascades. Again, this is one of those ones where we think, if you superficially look at the data, we think we know what's going on. The more you dive into PubMed, the more weird and complex it becomes. We don't, I think it's fair to say we know a little bit, but we don't know a lot about the mechanisms. We're getting there, but there's a long way to go. And I think it's nice to be humble and be open to open to science moving forward. There's various theories. One of them that's quite popular is the intramyocellular lipids. So this is fat in the muscle cells that locks off the insulin receptors and stops the insulin from unlocking the door to let the sugar in. So this is just an image of the green dots of the fat in the cell, in the muscle walls. And these are just a whole spectrum of papers talking about it, its theory, how does it work, does it really work? So that's one theory. The theory is there's fat in the muscles. Saturated fat is blocking up the locks so the door can't be opened. Other theories of the microbiome, we'll hear, I'm sure, about that later. But there's a whole complex scenario and a range of different things involved. Again, I don't have time to go into the details, and I'm not sure we really understand them yet. Like, for example, the incretins, they're the DPP4 inhibitors. So these are gut hormones released after eating. This is a simplified schematic diagram of what we think is going on. Yet again, there's 100 trillion or 1 to 100 trillion bacteria in our gut. We don't know how it all interacts. So I suppose the idea is it's really complicated. There's no simple, underlying mechanism that we've found yet. So what do we do? So in terms of the diabetes, we can reduce the sugar in the blood, which is what Sean mentioned, that initial understanding of what diabetes is. Again, going back to the mopping the floor analogy, or we can try and reduce insulin resistance, which is like turning off the taps. So if we're not quite sure how it works, then what are we going to do? I think it's probably going to be clear by the end of today that it's a whole foods, plant-based diet is probably the way to go. And I know we've touched on it, and I'll just go through another quick definition because I think it's important. The difference between vegan, as Donnie said, Dr. Holman said, and a whole foods plant-based diet is huge, and we'll touch on that a little bit later. The vegan is something where you exclude things from your diet, and the whole foods plant-based diet emphasizes the legumes, beans, whole grains, vegetables, fruits, nuts, seeds, which is most or all animal products. So it seems that the key components when we look at it is the protein. Is it animal protein? Is it saturated fat, which again mostly comes from animal products? Or is it refined carbohydrates, your white bread, your bagels, donuts? Or is it whole carbohydrates, as in whole plant food? That seems to be a sort of the general focus of what we're interested in. So again, these are just what I want to sort of give you is the weight of evidence. So we're not going to go necessarily into all the individual studies, but it's a consistent finding from the prospective studies in the association of plant-based diets with a lower type 2 risk of diabetes. So we're saying, even if we don't know the cause exactly, we don't know the exact mechanism, we can look at all these people and we can say, you know what, if they eat more plants, they're less likely to have diabetes. And they're not going to have many side effects. So it's something we can sort of confidently suggest. And we've got some, 500,000 Chinese adults there. We've got some big studies, a lot of data. These are separate papers from the last slide. So these are over and above stories. So this is from Finland. It was about 2,000 men, and they said replacing 1% energy from animal protein with energy from plant protein is associated with an 18% decreased risk of type 2 diabetes. Now, I'm not a statistician, I don't profess to be one. I'm sure people can go and look at that paper and question their methodology and things, which is fine, and by all means do so. But some of the figures and the numbers are just incredible. And it's just coming from so many different institutions in so many different countries that there has to be some solid truth behind it. There has to be that way to it. So yeah, this is a 20-year follow-up. This is another study, the Interact Consortium, the EPIC study. How many people have heard of the EPIC study? Hands up. Good number. So that's a European-wide prospective study. In this particular one, they were looking at 11 years of follow-up, 12,000 cases of diabetes, 340,000 adults, 8 European countries. So we've got a nice European spread and a nice large study. Again, confirms a positive association between high consumption of total and red meat and incidence of type 2 diabetes. So again, this is back to is it animal protein? Is it saturated fat? We don't quite know, but these are associations. This is from BMJ, slightly more recent one. These are UK researchers, and they're just simply looking at the plant-based diet. And this one is interesting, and I like this one. And this is concluded that plant-based diets accompanied by educational intervention can significantly improve psychological health, quality of life. So that's really important, because health or suffering isn't because you've got a disease. You don't suffer because you're ill, or you have a disease. You suffer because of the way you think about it. You suffer because of your mindset. So even if a plant-based diet did nothing but improve your psychological health and your quality of life, that would be valuable. That would be worth it. But it doesn't. It also improves HbA1c levels, weight, and therefore management. So, we've got a good reason to go for that. This is the European Journal of Epidemiology, the Rotterdam study, yeah. Again, plant-based diets, large population-based cohort, you've got a lower increased risk, protected role of diets and plant-based foods and lower in animal-based foods. Again, the same things. So this is a different country, different researchers, same general conclusion. These are from Wisconsin in America. Again, this is another good conclusion. Clinicians and healthcare providers should feel confident in recommending a vegetarian diet to their patients who have pre-diabetes or type 2 diabetes. So they're not saying there's any question. They're saying you should be confident. You should just feel free to do it. Don't be shy. Don't be afraid. Which is this has moved on. This is a new. A fairly new report, September 2018. 2 or 3 years ago, I'd never seen anything as confident as that. Again, this is from Harvard. We're looking at 3 big studies. Pre-chronic disease at baseline. And here, our study suggests that plant-based diets rich in high-quality plant foods associated with substantially lower risk of developing type 2 diabetes. Again, this is a different group of researchers again. We're all saying the same thing. This is going to be, unfortunately or fortunately, a repeated pattern. It's the same underlying mechanism. We might not find it. We might not know the detail of exactly how it works, but it seems to work. But this is also important, is the high-quality plant foods. So this is just from a graph from their paper. So the red line is the unhealthful plant-based diet. So that's your classic junk food vegan, so to speak. And that's actually worse. And the green line is the healthful plant-based diet index. So again, really important, we're not talking about vegan or per se. We're talking about a specific whole foods plant-based way of eating, and that's echoed across all of the things. So let's think about what's the consensus. So this is the American Association of Clinical Endocrinologists and the American College of Endocrinology. This is their executive summary from 2019. They brought one out every year since 2015. You know, lots of letters after their names. I'm sure they know what they're talking about. This is the list of disclosures of those authors. So, might notice a few drug companies in there. The first one and the third one have no commercial interest, but everyone else is deeply enmeshed in the commercial world. So I wonder what we think. What are they going to be saying? What are they going to recommend? What are their principles? Number one, lifestyle optimization. That's what they say. Well, of course they're going to have to say that. I haven't got to that one. So it begins with nutrition counselling and education. They should strive to attain and maintain an optimal weight. So that goes back a bit to Roy Taylor's work in Newcastle on weight loss and diabetes. I'm not touching on that. Through a primarily plant-based meal plan. So again, we're hearing the same words over and over again. And they've been saying a plant-based meal plan since 2016. So this isn't new. They changed, the weight is new actually. That wasn't in the 2018 guideline, that's come out in this year. So the words change, the plant-based meal plan is consistent. And what does that mean? So they say a multidisciplinary team. So we should discuss on focusing on foods that promote health, so not just avoiding animal products, but eating healthful foods. Information on specific foods. They want us, the physicians, the dietitians, the nurses, to focus on meal planning. You know, how do you decide what to eat? On grocery shopping, they want you to they want us to tell them what to buy in the supermarket or the shops. And dining out, they're recommending that we tell our patients how to order a plant-based meal in a restaurant. I mean, this is good stuff. This isn't glossed over. This is you know, getting at the nub of it. And they do say you can use drugs as well. That's fair enough. I mean, drugs can be useful. I mean, drugs do help. They do reduce risk. But this is, I mean, I think that was really, really good. And this is just a slide from their algorithm, and I think it's quite useful because it covers a lot of things. So we talk nutrition, we talk physical activity, which is also really important. We talk sleep, again, a newish one on the agenda. We talk behavioural support, smoking, obviously. So that is diabetes, cardiovascular disease. We're going to see the same kind of idea. So this time we're looking at increased mortality and incidence of atherosclerotic cardiovascular disease. And these ones suggest if you eat more, you're more likely to. And these are high impact journals. The Archives of Internal Medicine, which became JAMA, I mean, they're proper journals. Again, we're not quite sure how it all works. There's lots of, you know, the more you dive into it, the more complicated. So we've got saturated fat, salt, inflammation. I mean, we've been talking about salt since the 1920s, when in fact one of the researchers in Kenya, they didn't, something like 1,800 people were admitted to a Kenyan hospital, and they didn't come across a single case of high blood pressure. And these were people who had been rapidly westernized from a tribal society to a Western society. And he came up, Doyinson, I think it was called, he came up with the idea that environmental stress, so westernization, the stress of modern living caused the high blood pressure. So I wonder, that was quite interesting to see. Inflammation, obesity, high cholesterol, high blood pressure, diabetes, TMAO, again, that's a complex gut microbiome thing. Endothelial dysfunction, well-postulated mechanism for plaque formation. TMAO, this is another interesting one. So these are just a couple of things from pharmacology journals. So just to show we're not just talking the medical press, we're talking pharmacology as well. So what they've said is potential dietary cause of atherosclerotic cardiovascular disease, suggested by the fact that vegetarians, especially vegans, have a much lower incidence of atherosclerotic cardiovascular disease than animal flesh eaters. Interesting choice of words, but that was so what did they propose we do? Did they suggest, well, maybe we'll just tell people to eat less, Or maybe we'll look for a broad spectrum bacterial lysase inhibitor as the next major thing to develop. And that's, again, this is another pharmacology journal. Levels of TMAO can be reduced by limiting the diet intake. So we're echoing the same points over and over again. Another meta-analysis from Italy, a comprehensive meta-analysis reports a significant protective effect of vegetarian diets versus the infant and/or mortality from celiac heart disease. And look at the numbers. These are impressive stuff. Go away, look at this research, read the data, make your own decisions. New England Journal of Medicine, 500,000 people, 3.2 million person follow-up years. Again, a higher level of fruit consumption was associated with lower blood pressure, lower glucose levels, and low and other dietary and non-dietary factors. Significantly lower risk of major cardiovascular disease. Again, we're seeing the same things. So what can we do? It's the same story. It's whole foods and it's plant-based. I mean, the details around the edge, they're to be discussed. It's about getting a dominantly whole food plant-based diet. This is just from the journal of the American College of Cardiology. Nuts, green leafy vegetables, plant-based proteins. How long have we been saying this? This is a researcher from Oxford. In 1999, he said we could prevent approximately 40,000 deaths each year in Britain if we all went vegetarian. So that's 800,000 people since he said that have died probably prematurely or potentially. I mean, these are big numbers, and we've been saying it for a while. This is your classic angiogram, the only diet to have been proven to reverse cardiovascular disease is a whole foods plant-based diet, low or no oil. If you're not familiar with angiograms, imagine you're looking at a river system. Picture A, nice big flat river at the top, then it gets really narrow in the middle. Picture B, nice big flat flow all the way down. This is the same heart, that's the same blood vessel, that's 32 months later with absolutely no drug therapy and only a whole food plant-based diet. I mean, this is impressive stuff. Again, Harvard, healthful plant-based diets should be recommended as environmentally sustainable dietary option for improved cardiovascular health. So this goes back, this has come out before the Eat Lancet report. Again, environmentally sustainable. I think Sean is on the money. We should be advocates. We have a social responsibility to do this. This is from Italy. Again, plant-based diets. Again, what can we do? This is looking at it on a population scale. And when to start? How early? How soon should we start? Just from Great Ormond Street. So if you've got fewer cardiometabolic risk factors, lower prevalence of vascular sclerosis. This is primordial prevention. So avoiding the development of risk factors. This is an editorial from Circulation. The first 1,000 days from conception. So we're talking about this right from the start. And this is a nice sort of final one. Further research is needed, not on how to effectively, not on is a plant-based diet effective, but how to effectively reach the population at large to promote a plant-based diet. So they've said that we're concluding the evidence is there. We just need to look at how do we convey that message. So you've all been listening, you've been looking, which is brilliant. You're all here, which is also brilliant. But it's not enough. It really isn't enough. If you're interested to speak, if you like what you see, if you think maybe there's something in this, the next step, and it's important, is action. We need to take action. We need to change our own diets. Read some of these papers, look at the evidence for ourselves. Maybe feel brave enough to suggest it to our patients. Speak out like Sean has. I mean, this whole gathering is because a small group of dedicated individuals took action. And this is how the Eat Lancet report says we're going to change things. This is how we affect the future. We don't work well in big groups. There tends to be a bit of the bystander effect. But in smaller groups in our communities, in our day-to-day lives, we can affect people and we can make a change.